Dr. David Sandman, President and CEO of the New York State Health Foundation. Thank you for joining me to have a conversation about community health.
Thanks for having me. I appreciate it.
David, what factors go into determining whether or not a community is considered healthy?
Where you live has a lot to do with your health, and it is sometimes said that your zip code matters more than your genetic code in determining how healthy or unhealthy you are. What we see are huge variations in neighborhoods and communities in terms of their access to healthcare, their access to healthy and affordable fresh food, their opportunities or lack thereof of opportunities to be physically active, to play, to exercise. And those factors are often related to even broader issues like income, like education, like housing. So there's many, many factors that contribute to your environment, and your environment determines to a large extent whether you can lead a healthy life or an unhealthy life.
For the last 5 years, the New York State Health Foundation has been working in 6 communities around the state, urban and rural, to improve community health. Well, what improvements have you seen?
We see more access points for healthy food. We see more farmers markets. We see more healthy retail places. We see more farm to table, farm to school type of initiatives in New York City. We finally caught up to other cities in the state and enacted universal free school lunch for every public school student. That's 1.1 million students, the largest public school system in the entire United States. We've seen the activation of parks. We've seen the activation of walking trails and biking trails. We've seen improvements in public safety as well. That's a threshold issue. You can't expect people to go out to, a park or let their children go play in a park if they can't be sure their child is going to be safe.
Healthcare is so much more than just receiving medical treatment, isn't it? But public health has been put into perspective by the outbreak of the coronavirus. What has it revealed to you about the state of community health?
The pandemic has brought into even sharper relief all of the structural inequities that exist in our healthcare system and in society. And that's very often about race and about class. And if you look at the data, you see a very, very disproportionate impact on communities of color, on low-income communities, in terms of infection rates, especially in terms of death rates. And that should not come as a surprise to anybody. If we're looking at communities that already started with worse health status, that had many underlying health conditions like asthma, like diabetes, like cardiac disease that left them more vulnerable, more likely to be without health insurance, and less likely to have disposable income, it's no surprise to people like me working in the field that those communities have yet again borne the brunt of this virus even worse. And in New York City, where I'm based, you can live just a few subway stops apart, and you can have years and years of difference in your life expectancy. So it really, really varies. And if you map where the impact has been worst, it's almost a perfect overlay with concentrations of poverty.
Observing how the coronavirus has affected public health in such a short time, how do you see the conversation about community health and public health taking shape going forward?
All of us have a desire in some ways to get back to normal, but I think we also realize maybe we don't want to go back to exactly the way things were. We've seen in stark relief, a lot of heroism in our healthcare system, but a lot of failures in our healthcare system as well. And it's a chance to repair and rebuild. In our country, we have underinvested in the public health infrastructure. We did not have adequate surveillance systems in place. We did not have adequate testing capacity in place. We don't have enough contact tracing capacity, what they sometimes call the disease detectives. We didn't have enough personal protective equipment. We underinvested in all of those things for so long And the bill has tragically come due during this pandemic. And it is a chance now to rebuild and shift the paradigm toward a system that is more based on prevention, more based on primary care, and more based on public health protection, and not just providing very high-tech care for people once they are seriously ill.
But David, how does the process begin? And how quickly can any changes take effect?
We have to confront, the racial inequities that have been on such stark display. I'm surprised when people express surprise about those patterns. They've been there all along. They're there in all of the health status data that we have, and this will eventually fade from the front page of the newspaper. I'm not sure when, but we can't have a short attention span. These are deep, long entrenched issues. It takes a sustained, long-term patient approach built on resident engagement and community members doing it for themselves with some support. But that is really what could maybe turn the dial in the other direction. And that's going to take time and resources and patience.
These are all crucial talking points that we need to keep thinking about. Dr. David Sandman from the New York State Health Foundation, I want to thank you again for joining me today to have this important conversation.
Thank you. I wish good health to you and your family.